In this video, we will tip of nose red and sore to touch, symptoms, causes, and treatments. So let's start now. The tip of nose is red and sore to touch, and now you're wondering what to do. As it happened for the very first time with you, so you have no idea about what it's called, the causes behind it, and how you can treat it quickly and block it from appearing ever again. We got you covered. Tip of nose red and sore to touch. The condition known as nasal furuncles or nasal vestibular furunculosis is a mucocutaneous disorder that's quite prevalent to occur in the general public. The ailment, when not treated properly, can lead to head and neck infections due to their relevance to the intranasal carriage. Besides, a recurrence in the symptoms can also be seen. The symptoms include, 1. Redness. The tip of your nose will become severe red from the inside and especially outside of your nostrils. Not only red, but you can also feel a slight puffiness on your nose. 2. Tip of nose hurts. When try to touch the red nose, you feel a slight disturbing sensation or a severe pain similar to touching a blister that can further be felt on the nose bone, head, and in extreme cases, neck. 3. Tender erythema. Rash-like tender, red bumps on the surface of the nose tip that will be sore to touch. Although it is a separate infection, however, it can occur as a symptom of nasal furuncles. 4. Nasal tip edema. Another symptom of tip of nose red and sore to touch is nasal tip edema, in which you can feel there is some fluid on the tip, causing swelling on your nose and making it painful to touch. 5. Stays more than 2-3 weeks. The duration of this problem will not be some days but many days and can take 2 to 3 weeks before disappearing on its own. However, the recovery can be hastened using proper treatments. You may confuse its symptoms with nasal vestibulitis. Nasal vestibulitis is another type of infection that occurs in the nasal vestibule, the area in your nostrils around the opening of your nasal passage. The symptoms include temporary redness or itching in your nose. As it can make the tip of nose red and sore to touch, people confuse it with nasal vestibular furunculosis. You may confuse its symptoms with nasal vestibulitis. However, these two are different. How? Let's find out. Understand the difference between nasal vestibulitis versus furunculosis. Nasal furunculosis and nasal vestibulitis are two separate infections, both caused due to hair-bearing nasal vestibules. A furuncle is a painful region of cellulitis that surrounds a hair follicle, whereas vestibulitis is a more widespread condition that frequently results in crusting. Although nasal vestibulitis goes away in some days, if not adequately treated, the infection can cause serious complications. However, this happens occasionally. Check some nasal vestibulitis pictures versus nasal vestibular furunculosis pictures to get a more idea about both.